Good afternoon, Dr. Sharma, and welcome again to another session on mental health.
Good afternoon to you, Dr. Vasconcelos.
Doc, today is Friday, November 13, 2020, and we recently had an election here in the United States, and evidently there is a winner. However, the sitting leader does not want to accept this fact, and a significant amount of people are anxious. So, the question to you from a mental health perspective, can this anxiety lead to depression, or can the circumstances we're in lead to depression, which will lead to anxiety?
Well, they're both correct that anxiety and the persons who are fearful of outcomes are unable to accept outcomes can cause people to feel depressed. And that's something we see that depression and anxiety do coexist. So also, as you said, there is the other side to it that the circumstances itself can cause both anxiety and depression. So there's anxiety about knowing what's going to happen. And it's generally another very good feeling because people would sense instability. And it's not a healthy state of affairs, especially as we have another crisis with the COVID still affecting the health of people. So it is absolutely correct that the circumstances can precipitate both anxiety and depression. And then the anxiety and apprehension that persons experience looking for finality can also lead to depression, which is really unfortunate because in the US we have about 17 million people suffering from depression. So when we add in anxiety, which is very common, probably the most common mental health disorder or brain health disorder, we're going to see a large number of people hurting.
So, Doc, since anxiety can impact depression, or depression can get complicated because of anxiety, how bad can it get?
Oh, pretty bad because depression itself, when it becomes a major depression, or even if it's in another form where it's what we would call maybe a functional depression, a persistent depressive disorder, which is pretty long standing. The major depressions are very, very intense. It's just a sense of unease and unhappiness with life and unfortunate thoughts of ending one's life and feeling worthless. So there's all these bad feelings going on, and that people lose interest in their activities around them, and they lose their appetite, their sleep is poor. They often will fall asleep but wake up early. Or when we compound that with anxiety, we're going to have a combination of symptoms that are both unpleasant because the anxiety symptoms are now apprehension, irritability in the mind, and in a behavior that's very inappropriate sometimes. Persons feeling like they're going to go into a panic attack and become very fearful. So anxiety itself has its own range of bad feelings. And the problem with sleep for persons with anxiety and depression, which is not uncommon, is that the persons with anxiety take a long time to fall asleep. And so you're going to have now the individual taking a very long time to fall asleep. And it's thinking in that time when they're not able to sleep, all the negative thoughts that are crowding their mind. And then waking up early and not able to go back to sleep because of the depression. That's a pattern of that. So we're going to have a combination of dreadful feelings.
Doc, what can we do about it?
Well, education again is very important that we should look at the state of affairs, understand that anxiety and depressions are coming from the brain. We know the centers of the brain that cause depression, and that's the limbic system, which is your amygdala, the hippocampus, and thalamus, and that's the depression areas. Whereas anxiety operates a little more differently, though the amygdala we know is involved. There's a lot more involvement of the what we call the prefrontal cortex, where that now actually can affect one's thinking process. And that's why we know that the way people think can affect how they feel and how they react to situations. So when we have a situation in a country which is unstable and persons are experiencing negative cognitions, it's going to affect their lives. So hopefully there should be some resolution to this impasse if it's there happening. Um, and that we can move forward because with closure, there's going to be peace. There must be a resolution. One thing is hanging in the air. It's like the sword of Damocles hanging over the person, and there's a sense of apprehension that something bad is going to happen. And that's not a nice feeling. So we can do treatments with medications that work beautifully. There are very modern medications now that carry little side effects. Or we can do therapy. Cognitive behavior therapy is shown to be very powerful too. Mindfulness training, and other support services. We have our spiritual support services. So there's many ways. Exercise itself also is very good to do to help with emotional problems.
Well, Doc, thank you very much for another session on educating us on mental health. And it's so important for people to know that there is help, no matter what the circumstances is, no matter how challenging the environment we're in, we have control over our minds and we can get help. And we thank God for people like you. And I look forward to seeing you soon in Guyana.
I look forward to that too. Thank you very much.